A new option is available for people struggling with what's reportedly one of the deadliest mental illnesses. We're talking about Coral Springs Eating Disorder Treatment Center here in Jacksonville. It's now accepting patients, and they say they're saving lives.
Renata DiGregorio is on our side this morning. Renata, what is the most important part of this treatment, and why is it so needed?
We know it is especially needed because more than 10,000 people die from eating disorders every year, according to the Strategic Training Initiative for the Prevention of Eating Disorders. Medical staff at this new treatment center say knowing the warning signs is important, but the next step is knowing there is help here in Jacksonville.
It can feel very alone. And I think that's one of the things that we really recognize is that nobody should go through this alone.
Nearly 30 million Americans struggle with eating disorders, according to the National Association of Anorexia Nervosa and Associated Disorders, and more than a quarter of them attempt suicide. Coral Springs Clinical Director Heidi Graber and Chief Medical Officer Dr. Lanty Jordanby say years ago, women would have to be extremely ill to be accepted for treatment. But that's not the case now, especially at their residential treatment center for adult women.
Standardly, the cultural idea of eating disorders has been that teenage girl that's struggling with body image, but that what we're learning and what we know is that it persists throughout life. It can be a lifelong struggle.
Coral Springs is the newest branch of the Drug and Alcohol Addiction Treatment Center, Lakeview Health, and has 26 beds, 1/3 of the way full shortly after opening. Women in recovery got here because their symptoms were recognized.
Generally, if they become very fixated on their body image, that's a big part of it. They may be fixated on what they eat and they're very careful about calories. Compulsive exercise is another warning sign where they're spending 1 to 2 hours exercising a day.
Jordanby encourages you or someone you're concerned may have an eating disorder to talk to a primary care physician if you don't have a mental health counselor to get help. You might not know this, fewer than 6% of people with eating disorders are medically underweight, according to the National Association of Anorexia Nervosa and Associated Disorders. You can find treatment near you. Just go to thisfirstcoastnews.com story. Renata DiGregorio, First Coast News, on your side.